No.
Head to toe. All right, there you go, folks. We're going to be working head to toe. I'm Jennifer here. She's been actually a long time patient. She's come in when she's needed for various neck, mid back, and low back pain, and haven't seen her in a while, but here she is today. By the way, I'm Dr. David Warwick, your local Lacey, Olympia chiropractor. Okay, so one of the things that chiropractors do in making their assessment is they'll look at the leg length in determining where they need to start adjusting or helping the patients. Any pain right here?
Oh, yeah.
So the first observation, lower hip right on this side, so we're going to adjust that area right in the pelvis, both sides. Okay, so she's pretty tender in here. So I'm just going to add some gradual pressure into there and try to match the resistance in there before I go ahead and adjust that area. Good. Take a deep breath in and release it. Breath in again, Jennifer. Good. And release it out. Both legs even. Go ahead, raise the right leg without bending the knee. And back down. Try the other one for me. Back down. Okay, yeah, I felt it in the lower back. So we helped align the pelvis. Now we're going to begin checking the lumbar spine right through here. With Jennifer, I like to do a little bit of traction on the vertebrae just to get that area flowing with a little bit of blood, as well as trying to relax the area because it's under such tension. You doing all right?
Oh, yeah.
Just good it came in.
Uh-huh.
Actually, Jennifer, I'm going to end up having you lay on your left side if you could for me. Right here. So we're going to adjust the lower spine. Just going to open up that joint just a bit. Right at L4, L5. Just come right into me. You'll stay on the table. There we go. Good job. Other way.
I think I've memorized where the arms are supposed to.
Nah, that's my job. There we go. Good job. On your back. You hear your allergies acting up a little bit.
Oh, yeah.
Breath in and release it out. There we go. Good job. So we're at T4. Now we're adjusting right at T6 and 7. You feel a nice movement there. Good job. Breath in and release it out. All right. Sorry about this. I'm going to be blocking some of the view. So what a chiropractor does is we'll motion palpate and feel the area of misalignment. A lot of times you'll come right into the tender spot. You'll feel, there we go. Come a little bit higher this time. Excellent. Now you can breathe, huh?
Yeah.
I notice you're not sniffing now.
Oh.
Is that amazing?
It is.
Lift your head. So when I made that comment, but that sometimes when people have allergies, a lot of times the upper cervical nerves will affect the sinus cavities. So chiropractors adjust that, not that it heals allergies. What it does is it takes the interference away from that nerve, pressure on the nerve, and your body starts to function more normal. So a nice gentle traction. I like to use a towel, and I'll position it under a certain portion of the neck, open up the joints, and
Oh, that's a good one.
for adjusting the ankles, because that can affect the lower back as well, including the knees. A lot of times what chiropractors will feel is a restriction on that joints in the body, and after adjusting the area makes a big difference in how people feel getting rid of that neck, back pain. You can relax your arms like a noodle. Is this the bad shoulder?
Yeah, actually my elbow.
Is that the elbow?
Yeah.
You got some bruising there.
I know, I was lifting the AC into the window. Or
Who won, the AC or you?
AC. And I got scolded for lifting it because it was too heavy.
And Rafe didn't do it, huh?
Yeah.
Good job. Let's have you sit up and say a little something to the camera. How's the adjustment?
Oh, much better.
Much
Thank
better.
you.
Feel better
Oh,
already?
Gosh, yes, thank you.
You're very welcome.
Oh yeah.
Anything you want to say to any?
It's awesome.